take it away.
Thank you. Lynn, can you hear me all right?
Yes, ma'am.
Okay. Thank you and good morning, everyone. Thank you so much for joining us today. I'm going to be giving you a presentation. Sorry, I'm having a little bit of difficulty with my slides moving forward here. There we go. So I'm going to be providing you some information today about our case rates, our mortality rates, testing information, a little bit about the healthcare system and our public health capacity in our COVID-19 response. So, to provide some national context, Michigan has recorded the 6th highest number of cases in the state, in the nation, in terms of states in the nation, and the 5th highest number of deaths. We have the 10th highest hospitalization rate as percent of total beds occupied by COVID-19 patients, and the 6th highest number of COVID-19 patients in the ICU. Our case rates per million people for COVID-19 are now above 500 cases per million and still climbing. Our percent positivity is over 12%. And the complaints of coronavirus-like illness in the emergency department has been increasing for 7 or more weeks. More than 15% of the available beds, inpatient beds, in the state are being used to treat COVID-19 patients right now. And that trend is continuing exponentially over the previous 5 weeks. The week of November 1st and November 7th, we had almost 300 people die from COVID-19, and our state death rate is currently 5.2 deaths per million people. We're testing more than 53,000 people each day in the last week for COVID-19. These are diagnostic tests. And our testing rate is over 6,000 tests per million people. A little bit more national context. All 50 states in the nation are seeing increases over the last 2 weeks in the number of cases. Just going to highlight the Midwest a little bit. Wisconsin, we're continuing to see rising hospitalizations and case rates. Indiana now has higher hospitalization rates than Wisconsin. And they have exceeded their spring peak in terms of cases and hospitalization. Illinois is showing rapid growth in hospitalizations and cases. And Ohio is also experiencing growing hospitalizations and cases as well as positivity, and they are now far above their spring levels. Michigan, as you'll see, has had a rapid rise in hospitalization and cases, and we're at about 75% of our spring peak right now. This is a quick summary slide that we share with different entities. This is a data poll. We look at cases from 7 days prior to the table date. So the case information on this slide, like the absolute cases per million and the CDC case trend, you can see, I don't know if you can see my pointer on these 2 columns here. That is from data that is 7 days prior to the 11th. We do this because we're looking at these case rates by symptom onset, and we want to make sure that the data are fully reported before we release them. So this is where we understand that the state as a whole is at over 500 cases per million. We're continuing to grow based on CDC's case trend indicator. You can see that these are the Michigan Economic Recovery Council regions here, those job sharing regions. All of the regions in the state are over 300 cases per million. Positivity, so the percent of tests in the state that are positive is at 12.5% and increasing. All regions of the state are over 9% positivity, and you can see that Kalamazoo is at 15% positivity. And the positivity is increasing in all areas. Testing is increasing as well. You can see our test per million rates there. However, it's really not keeping up with positivity or case rates. Another thing that this summary graphic gives you is the weekly trend in coronavirus-like symptom complaints in the emergency department. We can see that apart from a couple of regions, that's been increasing over the last week, or in some places 4 weeks. And we're also have here the percentage of inpatient beds occupied with COVID-19 patients and our number of deaths per million people here. So it's sort of a one-stop slide for a lot of the indicators that we track. So I'm going to go through some more in depth about those kind of indicators that you just saw. A couple of high-level messages. As I said, positivity continues to increase statewide and with all of the MERC regions. Testing has also increased in the state, which is a very important trend. Our testing has increased 89% since October 1st. However, percent of those tests that are positive has increased 290%. So what that tells me as an epidemiologist, when I see that the state case rate has increased 425% during that same time, is that we need to be testing more. So it's very important that if people feel they need a test, that they go get one. It's important that we understand where cases are occurring so that we're able to respond appropriately. Another high-level message is that cases and deaths are rising in all age groups and among all racial and ethnic groups that we record data for. The number of COVID-19 outbreaks that local health departments are investigating also continues to rise, particularly in long-term care facilities, schools and sports, in-person workplaces, and restaurants and bars. So this is a graphic that is showing you the number of, the gray bars are giving you the number of diagnostic samples tested each day, and the blue line is giving you the average percent of those tests that are positive. In this case, this line includes testing that is accomplished at Michigan Department of Correction facilities. When we add those facilities in, our positivity gets to about 12.1%. So you can see that the prior week, Michiganders had more than 57,000 diagnostic tests for COVID-19 each day, and you can see how quickly our positivity is increasing, which is an indicator to me. Positivity is an early indicator that our number of cases are going to increase. Okay, this is another slide that gives you a snapshot of where Michigan stands relative to other states. We continue to be in the top 5 rank of the nation for the number of tests and the percent of the population that we're able to test each week, but we've declined in rank for the percent positivity this week, and a higher number is worse in that case. Also wanted to provide you with information about the spread of this percent positivity by county. So this is looking at the positivity rate for each county in the state between November 8th and November 14th. And you can see that most of the counties in the state averaged 10 to 20% positivity over that last week.
Well, thank you very much for...
Sorry, just everybody needs to mute their phone, please. I think, thank you. So just shifting gears a little bit, what this graphic is giving you is the confirmed, so these are the number of lab confirmed COVID-19 cases that are reported each day. So if you look at the michigan.gov/coronavirus website, those are the front page of that website, these are the numbers that get put up there. The gray bar is giving you the number of reported lab confirmed cases, and the black line is giving you the 7-day rolling average. So you can see the increase in that rolling average over time. And in the last week, we had more than 47,000 cases reported to us. All right. As an epidemiologist, the information that I'm most interested in is understanding when someone became ill. So this is information that the top 2 graphics here are looking at the number of new and confirmed probable cases by date of when someone stated they became ill, or the day that they were tested if they are asymptomatic but positive. So a couple of take-homes here. One more technical detail. We put this little gray bar here to show that we know that the data are not fully reported at this point. There are going to be more people who have onset of symptoms now who haven't yet had a chance to be tested. So as we did with hepatitis A, for example, we still look at these data, but we recognize that they're not a stable estimate yet of where we are. But what you can see is that these are data that we have our spring peak here. We have our elevated incidence plateau in the summer in terms of the number of cases we had, and then we have this rapid exponential growth. And currently, our daily case rate is over 5 times the rate it was from early October. Current deaths, which is the lower graphic here, you're seeing the number on the right-hand side, you're seeing the number of confirmed and probable deaths by the reported date. The current deaths are a lagging indicator, so that we know that these number of deaths, even if we start bringing our case numbers down, this number of deaths each day is going to continue to climb. The current number of deaths is over 4 times the number that we saw in the beginning of October. This is another way to look at the average daily number of new confirmed and probable cases per million residents by county. It just gives you an idea of where we were in the beginning of September, and then you can see how the map just becomes darker and darker with time. And currently, all counties in the state are over 150 cases per million. This is information on the average daily new case rates per million residents by age group. The lightest blue line are cases that are occurring among people who are over 70 years of age. The highest line here that you see, this blue, is people who are ages 30 to 49 years old. So the 30 to 49 year age group is continuing to have the highest case rate per million people, but it's important to recognize that case rates have exponentially increased for all ages in the state. Just looking at the case rate per million people by racial and ethnic group. So on the left-hand side of this graphic, you can see the 7-day case rate per million average over time. The light blue line here is representing white residents. The black line is representing American Indian Alaska Native residents. The sort of cobalt blue, I guess I'll call it, the third highest line here at the end, is representing case rates for Black and African American residents. And then we also have case rates representative for Asian Pacific Island residents. So you can see that all groups are experiencing increase here, which currently white and American Indian Alaska Native residents are having the highest case rates in the state. If you go over here to the right, we're providing you the distribution of cases by race and ethnicity for the past 2 weeks, as well as the distribution of these racial groups in the population as a whole. So it's just another way to give you some comparative information about what different groups are experiencing in the state in terms of COVID-19. I'd just also like to highlight that individuals who are Hispanic Latino, the case rate for this group has been, since middle of March, has been higher than that for cases who are, for people who are not considered to be Hispanic Latino, but both groups have seen a rapid increase in their case rates this fall. Moving to the number of outbreaks. So what this chart is, this is the same information that we put up on the website once a week. This is the number of outbreaks that are under investigation by the local health department, and they report this to us in a situation report at the end of each week. There are many factors, including the ability to conduct effective contact tracing in certain settings, that may result in underreporting of outbreaks or under-identification of outbreaks. There are some outbreaks that are easier to spot or to identify than others. And we give a sort of key to how visible we think it is, how each kind of setting is in terms of being able to identify outbreaks there in this series of blue and black circles here. So this chart will not provide a complete picture of all outbreaks that are occurring in the state, but it does provide you information about what local public health is investigating and dealing with right now. The absence of identified outbreaks in a particular setting the absence of those outbreaks is not providing you evidence that the setting does not have outbreaks in it. So just to highlight the data that are on this slide, local health is currently investigating 980 outbreaks in these different settings. The total number of active outbreaks is up 32% from the previous week. This is the highest number of outbreaks we have recorded since we began tracking these data. Following long-term care facilities and educational settings, the greatest number of new outbreaks are reported in manufacturing, construction, restaurants and bars, retail, and social gatherings. And the new outbreak is highlighted in blue. But we can see that there were reported outbreaks. The total number of reported outbreaks are highest among manufacturing, construction, healthcare, restaurants and bars, social gatherings, offices, childcare setting, and retail setting. This is another presentation of data that are also available on the state website. These are the number of outbreaks that are associated with school buildings. So in this case, there are 200 outbreaks that involve student and or staff within a K through 12 building. Note that 1/2 of the 200 outbreaks, almost 1/2, 97 of them, occurred in high schools. And you can also see here the number of cases that are associated with different settings, total cases. And we can see that 565 of the 881 outbreak-associated cases in K through 12 schools are occurring in that high school setting. So moving into talking about mortality, the bar chart on the right gives you the number of confirmed and probable deaths by age group in the past 30 days. A couple things to take home here. The deaths are, of course, highest among people who are over age 80 on this graphic. However, we are seeing deaths among people who are under age 60. And on the right-hand side, you can see the age-specific case rates per million people. You can see that all groups are experiencing increases, with the exception of some of these very small rates down here. And it's important to understand sort of the exponential increase in the mortality rate here. This is the same information for racial and ethnic groups. Not going to go through this slide in detail, just wanted to highlight that we're seeing increase in all groups, and we're seeing mortality rates highest among white residents and non-Hispanic Latino residents, but all groups are experiencing increases. So moving on to talk about healthcare capacity. Since September, COVID-19-like illness that is reported in the emergency department has gone from less than 2% of all emergency department visits to more than 7% of emergency department visits. Hospitalizations and ICU utilization for COVID-19 is also increasing, and we're seeing doubling rates of 2.5 to 3 weeks. So the number of patients being seen is doubling in a 3-week time period. 5 of 8 preparedness regions in the state now have more than 30% of their adult ICU beds occupied with COVID-19 patients. So we wanted to share with you some data from CDC COVID Tracker. The purple line here is showing you the increase in the number of people, or the percentage of people in the emergency department who are seen because they have a coronavirus-like illness complaint, or they've received a diagnosis of COVID-19 in the emergency department. And you can see this rapid increase since September. These are our state hospitalization trends. This week, COVID-19 patients in the hospital, we had a census that was 33% higher than last week. You can see in this small graph on the lower right here that we are now at 75% of our spring outbreak levels. But it's important to remember that these hospitalizations are spread across the entire state as opposed to concentrated in Southeast Michigan like we were in the spring. So similar graphics for the utilization of intensive care units for COVID-19. COVID-19 census in ICU has increased 30% this week. Statewide, about 27% of adult ICU beds are occupied by COVID-19 patients, and you can see the occupancy for different preparedness regions here on the side. So 5 of 8 preparedness regions have over 30% of adult ICU beds occupied with COVID-19 patients. And this is giving you regional information about how quickly hospitalizations are increasing in these states, in these preparedness regions. Regions 2 North, 3, and 6 are seeing the most rapid growth rates here. So now moving on to public health capacity. I'm going to talk a little bit about case investigation and contact tracing. Also going to talk about testing here. So our case investigation and contact tracing system is, becoming overwhelmed with the number of new cases and contacts that it's expected to manage. So our completion rates are quite low right now. However, I have some good news. Really want to promote the use of a phone proximity notification app that the state government just recently released. So these are case investigation metrics that we track each week. Just to take you through this graphic a little bit. We have the number of cases that were referred to local health between November 7th and November 13th. Was almost 40,000 cases were referred for investigation. They were able to get a full, complete case investigation for about 23% of those. And we have been much higher in terms of our completion rates than where we are now. 9,100 cases did have a complete investigation, and I think that is the highest number that we've been able to complete during the epidemic. So we're certainly adding more staff. We're working hard to get to as many of these cases as we can. Among those cases that were investigated, about 44% of those cases could identify where they may have picked up their COVID-19, what a potential source of infection would be. We want that percentage to be as high as possible in order for this box-it-in strategy of identifying where spread may be, finding contacts of cases, and getting them into quarantine quickly. In order to do that, cases need to be able to know where they became infected. The other figure that we monitor very closely is what percentage of cases stated that they were already in quarantine at the time that they developed symptoms. Less than a third of people are in quarantine at the time that they develop symptoms. What that means is at the time when people are most infectious, they are unfortunately not in quarantine and can be infecting other people. So we like to see that number up much higher than it is right now. This is another way of understanding our case investigation metrics. You can see the black line is giving you the daily number of new cases. It's a 7-day smoothed average. And then the blue line is giving you the number of cases that we were able to reach within 1 day, or the number of cases we attempted to investigate within 1 day. So because of this influx of cases, we want to make sure that we're not falling farther and further behind in time. So we worked with local health departments. I know a number of them have already put out press releases talking about how they are going to be prioritizing case investigation. We are continuing to bring in new staff, additional staff, both at the local and state level, to bolster our system here. There's some good news in terms of the number of completed calls to the contacts of cases. We've been able to turn that number around, and we're now reaching 45% of known contacts within 1 day. Also, among those contacts, they are able to call back TraceForce to ask questions and to find out more information, get referrals. And calls to TraceForce have more than tripled this week, meaning that we're still able to give meaningful support, effective support to people who are isolating and quarantining. So something that I think will be very helpful for us in Michigan is the use of this My COVID alert. I'll go through this briefly. This can be downloaded to iPhone or Android platforms. It's available in the app stores for both of those kinds of platforms. This does not track your location. So this is not something where, like some people's phone apps or running apps or things like that, where it actually knows where you are on the planet. All which this app does is record what phones your phone may have been near, if that other phone has this app downloaded as well. So what happens is that information lives on your phone. If you become a COVID-19 case and you talk with your local health department, they will give you a code. You enter that code into the phone, and the phone identifies, what phone numbers you have been near for 15 minutes over a 24-hour period, and then sends an exposure notification to all of those individuals, or to all of those phones for the individuals to look at. It's a very nice app. More than 280,000 people have already signed up for it. I think it's a way people can be proactive and can help to understand exposures that they may have had. A couple of new things about this app is we do have Spanish and Arabic translations of these materials coming very shortly. The last slide I have for you, one last slide in the public health capacity section here is we do monitor the turnaround time for diagnostic tests in the state. So for any lab that has reported more than 1,000 results in the past 2 weeks, we look at the average turnaround time in the past 2 weeks by those laboratories. You can see on this slide we understand which ones are commercial, which ones are hospital. Our 14-day average testing turnaround right now is 2.7 days. So that's the time from when a sample was collected to when public health received that electronic message. We're at about 2.7 days for all the tests we've received in the past 2 weeks. So just to highlight the last thing really quickly, that we do look at data to understand how is COVID-19 and the response to COVID-19 influencing other kinds of healthcare services and public health services that people make use of in Michigan. So a couple of things to highlight are childhood preventative services like lead testing and vaccinations. Childhood vaccinations did fall during the springtime, but those numbers have been rebounding. We also do look at the use of emergency care data, use of emergency services, use of emergency department. So our emergency department visits currently are, the utilization of the emergency department is lower than it has been in years past at this time. It's important that people understand that they can go to the emergency department if they need to. It's a very important source of care. The percentage of EMS transports for opioid overdose, or the use of EMS, pardon me, the use of EMS for opioid overdoses has also increased during this year compared to last year. And then we do have some information on mental health impacts. Just going to jump to that slide really quickly. Looking at the slide here, number 3, what you have is the proportion of emergency department visits for mental health concerns or mental health related complaints in the emergency department. So you can see that in March, the percentage of all ED visits that mental health complaints made up increased. It has been declining or holding steady since then. Something to be aware of is that, the denominator here declined. So when I see this increase here, that may be that more people were seeking care for it, or it may be that fewer people were seeking care for other concerns. But it's important that we have some way of understanding mental health services in the state during this time. Thank you very much. I know I went a little bit long there, but I will turn it over to Lynn Suffin.
Thank you, Dr. Lancallo. That was great information. So we have a few minutes left for questions. I really would like to tailor them to the data. So if anybody would like to ask a question, please raise your hand. Let me know that you want to talk. I will, call on you. Callie Rainey, would you like to unmute yourself and ask your question?
Yes, hello, good afternoon. I am just want to know the death rate right now seems to be lower than what it was back in May. Is that accurate? And if so, I mean, do we kind of have any reasoning on what that is, and is it going to get worse to continue to climb?
Yeah, so the mortality rate will continue to climb even if we start bringing case rates down now, because mortality rates tend to go up a few weeks, a couple weeks after the case rates have increased.
Karen Bouffard, if you'd like to go from the Detroit News, go ahead.
Yes, sorry, I had to unmute myself. When you look at the demographics of the people who are testing positive, you mentioned that the case rates are highest among white and Hispanic populations right now. And in last outbreak, they were highest among African Americans. I'm wondering if the change in demographics is more a function of the composition of, the population that, the areas of the state where the outbreaks are greatest right now, as opposed to, the proportion of African Americans that are infected. In other words, is it really indicate in any way that African Americans are not subject to disparities in terms of severity of illness and mortality that were identified in the first outbreak?
Yeah, so I think it's very important to understand that comparing the fall to the spring can be difficult because we had such a different testing environment in the spring. I think certainly the case rate, I need to make really clear that the case rates, that when I say confirmed and probable cases, that will include people who have had, who are epidemiologically linked to another case, so they have symptoms and they have exposure. It may be people who have had an antigen test. So it's important to understand the difference between confirmed and probable cases. So there may be people in there who haven't received a test for COVID-19, but are part of an outbreak and have epidemiologic exposure to someone who is a COVID positive patient. So in terms of your question, most certainly we are seeing, in the spring, the outbreak was, or the pandemic was very much focused in Southeast Michigan, which does have a higher proportion African American residents than, for example, the UP. And you saw in those county level maps that currently the entire state is experiencing very high rates of COVID-19. So some of this is reflective of the demographics of the state as opposed to the concept of disparities, but it is absolutely important that we continue we've done a lot of work to ensure that we're making testing available in communities that have social vulnerabilities, and that we are making sure that we're getting masks and PPE to businesses and masks to individuals who may not be able to supply one for themselves. So.
Thank you. Julie Mack, if you have a question, you may go ahead, unmute yourself.
Thanks so much for doing this. I really appreciate it. I actually have two quick questions. Well, maybe they're not that quick, but one is, they're both from people, comments I hear from Facebook. One is the fact that the Detroit numbers are actually below the state average right now. Is that a sign of herd immunity, or just that people in Detroit are being cautious, or what's that about? And the other question has to do with, that I see a lot on Facebook, is that some of these other things like mental health issues and people not getting emergency care, the whole, the cure is worse than the disease. And could you talk about that aspect of it, that these unintended consequences that we're seeing, is that, how is that factoring into your thinking about restrictions and so forth?
So I think it's, I do not have enough information on people's behavior in terms of use of masks and things like that to really give you a solid evidence-based answer to your first question. I think that communities that have already experienced an increase in have already had a big round with COVID-19, perhaps have more understanding of the effectiveness of masks and the importance of separating. I think that your second question, I'm just going to throw it out and see if Dr. Caldoun would like to say anything on that one.
Thank you, Dr. Lyon-Callow. Yes, to your second question, let me be clear. For people not coming to emergency departments were not closed by any epidemic or governor's orders. So the real enemy here is the virus. We have today, all healthcare is open as long as they have capacity. So again, it is not an order. It is people changing behaviors. It is hospital capacity changing because of the virus.
Okay, thank you, Dr. Caldoun. Maureen Halliday, if you'd like to ask your question, go ahead and unmute yourself.
So I actually have two questions. One's pertaining to testing. You're saying that testing isn't keeping up with the positivity rate. I'm wondering what the solution would be to that. How are we going to increase testing? And then, there's been talks about a vaccine. When a vaccine does come out, how quickly should we expect these positive cases to drop?
I can take those if it's okay, Dr. Lyon-Callow.
Sure.
So for testing, you're absolutely right. As we see positivity go up, it means that there are likely more cases and we need to expand our testing. So we have been working incredibly hard, expanding antigen tests across the state, focusing on vulnerable populations. I hope that at some point we receive more supplies for these antigen tests from the federal government. We are also looking at expanding our capacity with in-state testing and looking very closely in working with partners across the country to increase our capacity there.
Okay.
Oh, and I'm sorry, I did not respond to the vaccine question.
Yep, sorry about that.
Sorry about that myself. So we are aggressively working to plan on vaccine distribution, but there is no question the day that vaccine becomes available, it will only be available in limited quantities. It will only be available for those that the CDC has determined are the highest risk populations, and that will start with healthcare providers. So it will be several months well into 2021 before that vaccine is even available or widely distributed to the general population.
Thank you, Dr. Caldoun. Kristen Lowe, would you like to unmute yourself and ask your question?
Thank you. Taking a look at the outbreak map that you mentioned at the beginning, restaurants and bars, I think 54 outbreaks associated with that. I was wondering how many cases are associated with those outbreaks, and also looking at the outbreak map, construction is much higher than restaurants. So why are restaurants and bars shut down and construction not shut down?
Yeah, so I want to make clear that the information that we receive on the situation report is what outbreaks the local health departments are aware of and they are working on. I do not have for that situation report does not provide the number of cases associated with each one of those outbreaks. We have it for schools because that's a different part of that situation report.
This is Robert Gordon. Can I just make a more general point in response to that question?
Absolutely, Director.
It is much easier to trace cases to people's places where people live, like institutional settings, or work or go to school, where they have core identification with those places. With restaurants and bars, we are talking about places where a person might spend an hour, and it is much harder to draw those connections.
Thank you, Director. Christy Tanner. You may unmute and ask your question.
Just unmuted, thanks. I'm wondering with the the latest news on some of the problems with case investigation and keeping up with the number of cases. What has been the impact on the response public health-wise? And then second, if the state has done anything to help any local health departments, or what help is out there for local health departments that are struggling to respond?
Sure. So we've been working with our local health department partners. We've developed I mentioned the TraceForce system. We've also developed a set of staff who are able to take over for contact tracing and case investigation at the request of local health departments. And I think all but 2 of them in the state have taken advantage of that support in one form or another. We've also developed a texting platform so that if someone is a contact of a case, we like to be able to reach out in some format to those individuals at least once a day for their quarantine period. So we have a texting platform that does that reach out to take some of the burden off. And we've also worked with local health to talk about, given the number of the sheer volume of cases that we're dealing with right now, how can we make sure that we're getting, the crucial information that we need and that we're consistent in our investigations. So we have come up with an abbreviated case investigation form that will help to shorten the period of time that someone needs to be on the phone with a case, which should enable us to get to more cases.
Okay. I still see a couple of hands up for Maureen Halliday. Did you have another question, or is your hand still up?
I did not have another question.
Okay. How about you, Karen Bouffard?
Yes, actually, I do have another question. I'm wondering if you can tell me how many additional employees the MDHHS has had to hire to cope with this pandemic.
So I don't have that sum total number. Oh, go ahead, Dr. Khaldun.
No, this is Lynn. I was just going to say we can work on that, Karen, and I can get back with you.
Okay, great. And I'm also wondering about budgetary considerations. This has got to all be costing a tremendous amount of money that wasn't budgeted, and I'm wondering whether or not, the MDHHS is going to have to somehow request more money from the legislature. How are you funding this, and what kind of difficulties are you, encountering due to budgetary issues, and what's the solution?
I can take that. So we have depended on federal dollars to supplement state dollars, and in particular funding under the CARES Act. That funding must be used by December 30th, and Washington's failure for months now to provide additional funding for the massive public health expenses that we face is an enormous challenge for the department and for the state.
So thank you. We are going to wrap things up right now. I will have a copy of the presentation. It is getting posted to the website. I will send everybody the link. I will also send a link to the presentation once that is available. If anybody has any follow-up questions, please contact me, sutphinl1@michigan.gov, and I will do my best to get those answered. Thank you very much, Dr. Lancello, Dr. Khaldun, and Director Gordon for joining us and providing some great information for everyone. And like I said, anybody has follow-ups, please let me know. Thank you all.